Hello guys, we need talk with you about orthopedic. I'm glad to see you. Today we have a short big topic. This topic we will delay on few topics with general dislocation. And how you understand, today we will talk about dislocation, or luxatio, like in Latin, and we will talk about general science, general etiology of all dislocation. Okay, let's get started. We have dislocation is a persistent disconnected of the articulation surfaces of the joint as a result of physical violence or a pathological process. How we understand that patients have dislocation? Often we see it, and we never see a joint, because it under the skin. But if you will look on picture, you will see the joint. This is leg, knee joint, and there we see that this surface don't connect with this surface, and this is wrong, and this is a dislocation. We never see it in patient, just when we talk about open dislocation. And may I don't try talking, and we will go to the next slide. Thank you. Competently, it's very important to talk right. I don't know how it is in English, but in Russian it's important that the name of the dislocation is received by the damaged joint. For example, the underlying segment of the joint is also considered dislocated, except, just one except, for the collarbone, for the clavicle, and for the vertebrae. For example, dislocation in the elbow joint or dislocation of the forearm, but not dislocation of the elbow joint. I repeat, dislocation in the elbow joint, and never dislocation of the elbow joint. But maybe it's just in Russian. Really, I don't know what about English. Okay. Etiology. The cause of dislocation is most often injuries of an indirect mechanism. And guys, please try to remember it because in all topic of dislocation you will hear an indirect mechanism, and if in exam you will hear an please call me etiology of, for example, dislocation of clavicula. You need to remember that all dislocation is indirect mechanism, and if you tell that it is indirect mechanism, you will always in eyes of your teacher be greater than guys who don't know that it is indirect mechanism. Okay, indirect mechanism. Thanks. For example, violent movements exceeding the functional capabilities of the joints. In this case, as a rule, the capsule of the joint is torn, the ligamentous apparatus is partially torn, the surrounding soft tissues are injured. There you see a few words in Russian. Sorry, I don't translate it. There need be a ligamentous apparatus. Okay, complication of dislocations. It's very important to remember it, and there we have just two complications: open dislocation and fracture dislocation. Sometimes all the coverings of the articulation are destroyed, yeah, including the skin. And in such cases, we talk about an open dislocation. In addition, fractures can be a complication of dislocation. The last two varieties area are attributed to complicated dislocation. Okay, and in picture you can see a fracture. Oh no, this is a bone open dislocation with fracture. Yeah, that's my fault. There I need to do dislocation and heat of the skin, wound of the skin, and we will call this situation an open dislocation. This is just open fracture, sorry. Yeah, and there you see that we have a fracture dislocation, because there we have a dislocation and there we have fracture. And look, forward we will talk about this, but please try to remember that always when you see dislocation, don't treat this, don't liquid dislocation without X-ray. It's very important, guys. It's very important. This rule will save your life and life of your patients. The separation of congruent surfaces does not always occur over the entire area. Therefore, along with complete ones, incomplete dislocation or subluxations are distinguished. Yeah, and there you can see a picture where you see shallow disced, yeah, hip dysplasia. Don't look in hip dysplasia, look to subluxation. There you see that we have incomplete dislocation, yeah, and we have some contacts with congruent surfaces of joint, yeah, but there you see that all surfaces go away and don't connect. Okay, classification. There are congenital and acquired dislocations, or purchased. The latter in turn are divided into traumatic, pathological and habitual accustomed dislocations. Traumatic dislocations. Traumatic dislocations are the most common type of dislocation, which are 2–4% of all skeletal injuries and 80–90% of all other dislocations. They are observed in all groups, but mainly in managed 20–50 years, who account for 60–75% of injuries. Classification. According to the time that has elapsed since the violation of the congruence of their articulation, dislocations are divided into fresh, stale and old. Look, there is some problem with translation. Some books tell that it is stale, some book tells that it is unfresh, but you can try use another word, but you need to understand that it is unfresh, yeah? Fresh, unfresh and long standing. This is more easily to remember. Okay, dislocation are considered fresh when no more than 3 days have passed since the injury. Stale from 3 days, unfresh. to 3 weeks, 3 days to 3 weeks, and old 3 weeks or more. Sorry, 1 minute please. Okay, now about clinic. Characteristics plasma in the analysis. Okay, there you see in picture a patient with left clavicular dislocation. Characteristic trauma in the analysis. Yeah, and first of all, you try ask for patient what about his analysis. Yeah, what happened to him, for example, and he will say that he have trauma. Complaints of severe pain in the joint and sudden loss of its function. Yeah, it's very important. For example, loss of function because he feel pain. Yeah, and he feel pain because he lost some function. No, because he feel pressure, non-physiological pressure in the tissue near the joint. The limb, depending on the dislocated segment, occupies a forced position. Yeah, it's very important to remember about forced position. The joint is deformed. Palpation reveals a change in the external landmarks of the articulation. Soreness. Yeah. There are no activity movements in the joint, and adapt to perform passive movements causes sharp pain. There you need remembering a symptom of spring resistance. It's when the doctor performing passive movements feel elastic resistance to movement, and when the effercaces, the limb segment returns to its previous position. Remember, if a dislocation is suspected, it is necessary to check the pulsation of the arteries, skin sensitivity, and motor function of the distal limb. Signs with dislocations, damage to the neurovascular bundle is possible. Mandatory in the recognition of dislocation is an X-ray examination, without which it is impossible to establish the presence of concomitant fracture without displacement and cracks of the roots. Subsequently, when attempting to correct a limb segment, a fracture may occur with the displacement of fragments. Yeah, please remember that we need to do X-ray, because if there is fracture, we have very big problem if we do a treatment of the fracture, of the dislocation and fracture. Yeah, and in picture you see where we can check a pulse of arteries. Remember, if a dislocation is suspected, it is necessary to check the pulsation. Yeah? And there I show you some dislocation with fracture, where if we do a liquidate of dislocation, we will have some problem. Treatment of fresh dislocation is an emergency measure, and it should be started immediately after diagnosis. Help begins with the introduction of painkillers. For example, you can use absolutely all what you have. Morphine, promedol, trimipyridine, and others. Then the dislocated segment of the limb is set. Rules for the treatment of dislocation. First of all, you need to remember, when eliminating a traumatic dislocation, the following rules must be observed. Manipulation is performed with the use of local or general anesthesia. Signs only in the case it is possible to achieve complete muscle relaxation. Yeah? And there you see a picture that, first of all, anesthesia. The dislocated segment of the limb is adjusted in the most gentle way, without jerks and rough efforts. Because if you will do any jerks, yeah, or rough efforts, it will lead to the non-right position of joint, or maybe, for example, broken of the bone or other. After the dislocation is eliminated, the limb is immobilized with a plaster cast, and there you see plaster cast. After removing the fixing bandage, a course of rehabilitation treatment is carried out. Therapeutic gymnastics, physiotherapy procedures, hydrotherapy, mechanotherapy aimed at relieving pain, normalizing blood circulation, increasing the elasticity of soft tissues. Yeah, no, and there you see this rehabilitation meropathy. Treatment of stale and long-standing dislocation. This treatment are solved on an individual basis, since the prognosis is not always favorable. And there you see that always we will use, not always of course, but often we will use a surgery treatment. Yeah, we will do operation. Sometimes we use interesting plaster cast with some really interesting mechanism. I never see it because often we use just operation. Okay, and patients with habitual dislocation are recommended surgical treatment. Guys, that's all. Thank you for your attention. Next topic will be about general and frequent dislocations. In next time we will talk about clavicular dislocation, and please be healthy. Thank you very much for your attention, and be healthy and be happy. Thank you.